You've missed your menses. Yes. You've done pregnancy test. No or yes. Perhaps yes, and it is negative. But you've missed your menses. A month is passing and you are very worried. This is the best video for you because I'm going to discuss about 10 factors that can make a lady to miss her menses. But she is not pregnant. She is not pregnant. Stay tuned and let's do this. Watch this video until the end, and if you have not subscribed to this channel, hit this notification bell written subscribe, turn it on for future videos like this that I will post. Now, the number one thing that will be reported is that, doctor, I'm stressed. I'm really stressed up. I don't know why. I've not seen my menses yet. Pregnancy test is also negative. Is the pregnancy hiding somewhere in my body? Sorry. When you are stressed, you invite the stress hormones. The hormones that respond to stress, these are prolactin and cortisol. Especially the cortisol now will really play a very big role here. Both will play a very big role, the cortisol and the prolactin. When you are stressed, then the hypothalamus in the brain will sense that. It will sense that. Now it will suppress the release of gonadotropin releasing hormone. When this gonadotropin releasing hormone is suppressed, then there will be another suppression of luteinizing hormone and follicular stimulating hormone from the anterior pituitary gland. And when this luteinizing hormone and follicular stimulating hormone are suppressed, then there will be no development and maturation of ovarian follicle or Graafian follicles. Thereby there will be no release of that ovum, and perhaps there will be no spermatozoa present to fertilize this particular egg, and therefore a baby forms. And then when we go reversely, and when the ovulation has taken place and there's no fertilization, then you will mense. You will see your menses. But when there is suppression, the way I've said, right from the hypothalamus, gonadotropin releasing hormone is suppressed, luteinizing follicular stimulating hormone and luteinizing hormones are also suppressed, then pituitary gland will not do its work and there will be no ovulation, therefore no menses. So when you continue getting stressed, no menses. Even if you think you might be pregnant, it can go even 4 months. So put stress aside and move on. I hope you've taken note into that. Number 2, weight gain and weight changes. This is due to when you are extremely doing an exercise to make your body to be lean, or you are eating too much. This will interfere with the menstrual cycle and there will be no menses, particularly when you eat binge eating or when you starve a lot. Exercising is very vital to our health, but if you do it too much, it will suppress the release of those hormones I've talked about. Therefore, you will make your body to be stressed. You will be inviting those stress hormones that I talked about from the adrenal gland, that is the cortisol, and you will not be able to see your menses. There's a disease called polycystic ovarian syndrome. Poly means many. When there is excess production of these hormones in your ovaries, then it will interfere with your menses. They will even irregular. Thyroid disease due to hypothyroidism, and hyperthyroidism due to increased levels or decreased level of thyroid hormones, both the T3, T4 and thyroid stimulating hormone will eventually interfere with your menses. When you are chronically ill, you've been suffering from cancer, or you've been suffering from HIV or even TB for a very long time, you might be you might not be able to see your normal menses. There are some drugs that play a very important role in suppressing the menstrual flow, making the menses to be missed. When you have the contraceptives, when you are using contraceptive, maybe daily pill, maybe depo-provera, or these hormonal contraceptives, they normally interfere with the menstrual flow first, even the regularity of that particular menses. Antipsychotic drugs for psychosis may make you miss your menses. Antidepressant, and even those who are passing through a lot, those cancer patients who are undergoing chemotherapy, they might miss their menses because of this. When you are approaching your perimenopause, which might even start around 30. Sometimes you will start with the regular menses and then you miss it at all. Traveling and lifestyles. When you change time zones, this normally even happen here in our country, Kenya, particularly those who are from Nairobi to Nyanza, or to Western, or to Northeastern, and vice versa. When you change time zone and when you change an environment, you are likely to miss your menses. So I would rather advise that it's very, very vital for you to do pregnancy test. Breastfeeding also has, when you are breastfeeding, there is a high level of prolactin, and this normally suppress the menstruation and even ovulation, and this may make you miss your menses and you are not pregnant. That's why we encourage each and every woman that breastfeeding is very, very key, and it's another form of family planning, though not much, but we encourage our mothers to breastfeed their babies very, very well. So guys, it is very vital that if you experience all this I've talked about and you've missed your menses, and you had a sexual intercourse which was unprotected, or even condom burst, then you've done your pregnancy test and perhaps it is negative. It is advisable that you do this pregnancy test after 14 days, after 2 weeks, to verify that you are not pregnant. Thank you guys for watching this video, and if you have not watched about early signs of pregnancy, that video might be appearing somewhere here. Make sure you watch it in full. Give us your comments below about this video and the one that you've just watched, and we really appreciate. Subscribe to this channel for more videos that we'll post. Muchas gracias.